If you're a practitioner working with geriatric patients and you are not doing anything with the vestibular system, then you and your patients are missing out. The vestibular system is the balance organ. You can't ignore it. In the US, 35% of the population over 40 has a vestibular dysfunction. The prevalence only increases with age. Those with vestibular dysfunction are 12 times more likely to fall. 32% of the people with vestibular disorders are not dizzy. Please listen. Most people think that the only ones who need vestibular rehab are those who suffer from dizziness, and I'm here to tell you that that is not true. It is likely that most of your balance patients have a balance disorder because of a vestibular dysfunction. That is why you must take this course. During this 5-hour virtual course, I will show you how to perform a vestibular evaluation without any expensive equipment, interpret the findings, and then use those findings to guide your treatment. I use more than 2 hours of real patient video content. I'm not only going to tell you what to do, I'm going to show you. When you complete this course, you will walk into the clinic with a whole different perspective on what your geriatric evaluations and treatments should look like. I cannot wait for you to join me. Welcome to this course on the implementation of vestibular rehab in the geriatric population. You just took the first step towards improving your patient outcomes in those with balance impairment. I'm so excited you decided to join us. The vestibular world can be intimidating to many people. I'm not going to lie, it isn't always easy. It has taken me over 100 hours of continuing education, 10 years of specialized clinical practice, and some amazing mentors to gain the understanding I have of the vestibular system. Most courses are 10 to 40 hours long, encourage the use of infrared goggles, and I agree, they are recommended, but not all practitioners have them. I have found that these barriers prevent many practitioners from doing anything vestibular related. There are many providers who want nothing to do with the vestibular system. I get it. I have developed this course for those practitioners who don't want to know everything about vestibular, but do treat balance patients and geriatric patients. You can't just ignore the vestibular system. I hope this course takes away some of your fears or uncertainties about the vestibular system, because although some things of the vestibular world are confusing, this doesn't have to be one of them. I have simplified the world of vestibular rehab into the need-to-know information for the geriatric population and those with balance dysfunction. I hope by the end of this course, you will have confidence in your abilities to functionally evaluate vestibular dysfunction in the geriatric patients in balance impairment. Let's get started. Here I've listed the objectives of this course. We're going to understand the anatomy and physiology of the vestibular system, understand the relationship between the visual and vestibular system, go into basic ocular motor and vestibular evaluation techniques, demonstrate clinical reasoning needed to differentiate a peripheral vestibular disorder from a central vestibular disorder, perform BPPV testing and the treatment modifications that are helpful in the elderly population, and then most importantly, understand when and how to incorporate vestibular rehab into your everyday treatments with elderly patients and those with balance impairment. Here are some statistics on why taking this course is so important. 35.4% of U.S. adults aged 40 years and older have been found to have vestibular dysfunction. This only increases with age, and patients with vestibular dysfunction and dizziness are 12 times more likely to fall. And as many as 32% of individuals over the age of 40 have no symptoms of dizziness, but do have evidence of vestibular dysfunction. Although these patients are asymptomatic, they are still 6 times more likely to fall. And that's why this course is important. Vestibular rehab is not just for those who are dizzy. This is a significant problem in the elderly. A case control study in the UK found that the prevalence of vestibular impairment in older adults who had fallen was 80%. When you looked at non-fallers, the prevalence was only 19% in age-matched norms. The prevalence of dizziness is estimated to be 30% in persons over the age of 60. However, once you hit 85 years of age, it's estimated that 50% of patients suffer from dizziness, likely due to vestibular dysfunction. Over 1/3 of older adults fall each year in the United States. Dizziness in the elderly leads to disequilibrium, which leads to fear of falling. That fear of falling creates inactivity. Inactivity creates more dizziness. And it's this cycle that these patients continuously go in. And our job as rehabilitation specialists is to get them out of that cycle. The presence of dizziness alone constitutes a major predictor of falls in the elderly. This is a big problem. The good news is there's something we can do about it. Physical therapists are the practitioners of choice in the rehabilitation and management of vestibular-related balance disorders. That was a statement published by the American Physical Therapy Association. The goals of vestibular rehab include reducing fall risk, screening and correcting BPPV, balance training, proprioceptive systems training, improving gaze stabilization, gait training, and optimizing function for improved quality of life. Some of these things you may integrate into your everyday practice already. If some of these things are not in your everyday practice, don't worry, they will be by the end of this course. Most importantly, please note, vestibular rehab is just as successful in remediating symptoms in the elderly as it is in a younger population. So age is just a number. These patients make great improvement with vestibular therapy. So before we go on for the rest of the course, I want to define a few terms. When we go through the information in this course, you may hear the words dizziness, lightheaded, disequilibrium, vertigo, and visual vertigo. So I want to make sure we're all on the same page going forward. Dizziness is defined as a floating sensation or sense of movement when there is in fact no movement. Lightheadedness can be a form of dizziness, but it is a feeling of being faint or like you're going to pass out, commonly associated with low blood pressure. Disequilibrium can be another form of dizziness, but it's defined more as imbalance, unsteadiness. I like to talk to my patients about, does it feel like you're on a rocking boat? Would be more of a disequilibrium type of dizziness. And then the third type of dizziness is vertigo. Vertigo is defined by a sense of spinning in motion when there is no motion. So lightheaded is faintness, disequilibrium is like a rocking boat or imbalance, vertigo is a spin, and all three of those are a type of dizziness. Then you have visual vertigo. Visual vertigo is dizziness that is caused by visual stimuli. So this can be open spaces, busy environments, busy patterns, like blinds hanging in a window, or a grocery store where the aisles are very, very busy with things. When a patient gets into that environment, they then feel dizzy. They feel off balance, but it's because they're in that visual busy environment. So that is called visual vertigo.